The difference between a baby conceived through IVF or naturally is just the manner of conception, how the conception occurred. But the rest of the pregnancy should continue like any other pregnancy. So for anyone watching this and you have tried for 1 year, then maybe you need to seek help. Or if you're 35 and above for the woman and you've tried for 6 months, maybe you need to seek help. So at the point of help is when now we now see, after evaluation, who now requires IVF. So there are several factors. So there's the female related factors and the male related factors. We are almost in the same age group and the time is also going. Yes, so yes, you can freeze your eggs.
Okay.
Yes, you can freeze your eggs. For if you do not have a spouse right now and you want to get your own biological children later, you can freeze your eggs now. But men, their biological clock. Men have also a biological clock.
Tell us.
Yes, because also the quality of sperm with age now for them from their 40s going up into 50s, also the quality of sperm goes down. There's something called DNA fragmentation. The DNA in the sperm, there's issues with that.
Hello, good people. Susie Yule Diadem, living positively regardless. Doesn't matter the point at which you are in life, but we raw positivity all the way. I am happy and I'm grateful to God that He has given us yet another opportunity to interact, to share, to impact, and also to learn some new things. Yes, kindly subscribe to our YouTube channel, help us to grow and help us also to reach out to as many as possible, because what we are learning today might not be direct for you, but it may be for your friends. So as you share for your to your contact, you may you may find that you have helped somebody. So kindly share our story. You are there and maybe you'd want to come to us and share your life experience, share your skills, share maybe a kind of knowledge or discovery you have made and you'd want to share it with the world. Kindly do not hesitate to talk to us. We'll give you the opportunity to do so. So you can either call us through our contact, which are down here. You can also maybe inbox me in Facebook, Susie Yule Diadem, TikTok, Susie Yule Diadem, Instagram, Susie Yule Diadem. Yes, you can find us there and just tell us that you are ready to come and share your story with us and we'll give you that time. And so today, guys, this channel, we are here to impact, to inspire each other, but mostly, you know what I love most? Talking about infertility. Yes, you know, this is my area. And you know, I always smile when I'm talking about infertility. Funny, yeah? Why would you be talking, smiling when you're talking of a weakness? I'll tell you, I keep reminding you why I smile about it. Because with or without children, we are still doing life. Imagine we are here. I am almost 40 years. I've not biologically been able to say I am a mother, but yes, we are still smiling. So that's why we talk about it while we are smiling. Before I talk a lot, I want to introduce the guest of the day. Coffee, just open up. Hello, Daktari.
Hello.
How are you?
Fine, thank you. How are you?
I'm good.
Okay.
Good to have you for a second time.
Asante sana.
How have you been?
I've been fine. Yeah, I thank God.
Nice. It may be someone is watching this video and have not met you before, have not watched the other video. So maybe I'll also give you an opportunity to introduce and say hi to our people.
Okay. Hello, everyone. So my name is Dr. Nyakoa Mukabana. I am a fertility doctor with training in obstetrics and gynecology and also assisted reproductive technology and embryology. That means IVF, just in summary. Yes, so I have worked in IVF for quite some time, and IVF means, the word IVF in itself, it means in vitro fertilization. So what IVF entails is when we need to assist a couple to conceive. So we are taking the eggs outside the woman's body and the sperm, and then we are fertilizing outside the body. That's the meaning of the word in vitro, outside the body. Then after fertilization has happened, this whatever is generated is called embryos. So now the embryos are cultured outside the body for 5 days, and then they are transferred back to the woman. That is called embryo transfer. So IVF includes the entire process for this treatment. Yes. Yeah.
Sorry.
Yeah.
Wow, guys. First of all, take a red pen and cancel pale tulikuwa tunasema test tube babies. Have you heard anything like that on that statement from a qualified doctor? That's why I have started from that point.
Yeah.
So that as we are discussing this, we are discussing nothing about test tube babies.
Yeah, test tube babies was a layman language, but even in the IVF lab, the culturing is not even done in a test tube, by the way. So that test tube is really, really a misnomer.
Okay.
So it's not the accurate word to use. And just to add something that people say, oh, IVF, they look at it as something very foreign, something very bad or out of the normal. But for IVF, it's just to help people who are having certain issues to conceive. And the difference between a baby conceived through IVF or naturally is just the manner of conception, how the conception occurred. But the rest of the pregnancy should continue like any other pregnancy.
Okay.
Yeah.
Both are conceived.
Yeah, the conception, this one, the fertilization happened outside, and this one, the fertilization happened inside the body naturally. But once the pregnancy sets in, then it's still
I'm repeating because I want you to keep repeating. Both are conceived, both are fertilized, both are like, it's the normal way of getting a baby.
Yes.
No baby is coming from America to be put. Wow, beautiful. Now, before we get so much into it, let's just know your journey of your academic level journey for you to come to this level of being an IVF expert.
Okay. So of course, there's high school and then there's university, where I did a Bachelor of Medicine and Bachelor of Surgery, MBCHB. And then after that, of course, I did an internship program, which is compulsory. So I got a very unique journey. So I went in immediately after my internship, I went in working in an IVF clinic directly, where I learned a lot of things in hands-on experience. But also I did a master's while there, a master's in human assisted reproductive technology and embryology. I know those are the very many words, but yes, like just to specialize in the IVF thing. And then immediately after that, I went in to do obstetrics and gynecology, because you have to understand the entire woman, not just fertility alone. Yes. So, and now I have experience in working in an IVF clinic for 6 years now.
Okay.
Yes. So that's what has gotten me here.
Oh, wow. Yeah. 6 years. We may not take it like the way you, maybe just to help a young man there or a young lady there who is in school, they are doing it. What maybe qualification is required in secondary school for you to come to this, to do this?
So IVF is a subspecialty. So first you have to I think get an A. Okay, I got an A plane to get into medical school. And then after you finish medical school, now my journey is unique, but the ideal journey is you get into medical school, finish internship, and then you go and do your master's in obstetrics and gynecology. And then now you do IVF if you want to be a fertility specialist.
Okay.
Yes. Yeah.
Yeah. Beautiful. You will at some point, as we share, you will tell us why your journey is unique, that you went direct into it. But now let's come to the real thing of doing IVF, and maybe just help us understand who are the people who requires this procedure.
Okay. So maybe I'll just take you back a bit and let's define infertility. Because like 3 weeks ago, I got a couple, a 28-year-old and a 23-year-old, coming to tell me they have tried to conceive for 3 months. And now, yes.
Wow.
So let's just start by defining when you require IVF, and then I will break down who will require IVF. So we can define infertility as inability to conceive after regular, unprotected sexual intercourse for 12 months if the woman is less than 35 years. But if the woman is older, 35 and above, then the period is shorter. That is 6 months of trying. So for anyone watching this and you have tried for 1 year, then maybe you need to seek help. Or if you're 35 and above for the woman and you've tried for 6 months, maybe you need to seek help. So at the point of help is when now we now see, after evaluation, who now requires IVF. So there are several factors. So there's the female related factors and the male related factors. So for the female, the people that might require IVF immediately is if someone has blocked fallopian tubes, because now for natural fertilization, the tubes need to be open so that the sperm and the egg can meet and then fertilization occurs. But now if there's blocked fallopian tubes at any age, then this person will require IVF treatment. Yes. And then another thing that makes someone require IVF is sometimes it's unexplained infertility. Everything is okay. In fact, unexplained infertility is a very devastating diagnosis, because now you start wondering what's wrong with my body. So we've done everything. We've checked your fallopian tubes, they're okay. The hormones are okay. The ovarian reserve is okay. But still this person is not conceiving. So for such a couple, if they are 40 and below, the woman is 40 and below, then we can try intrauterine insemination first. And if it's not working, maybe 3 or 4 cycles, then we can now move to IVF. So that can be an indication for IVF treatment. If the rest of the treatment is not working, then we have to move to the next level, which is IVF. Another factor is if we check the ovarian reserve and find that it's quite low, so we can just directly go into IVF instead of starting to try with other treatments, because now time is of essence, because now the ovarian reserve is going down. Yes. Other factors, endometriosis, they're not directly an indication for IVF, but if the rest of the treatments are not working, then IVF is the next treatment. Now for the male, because fertility is not, I keep saying this because we have really branded the woman as the problem, and it's not even a problem. Infertility is a medical condition where the reproductive system is not doing what it's supposed to do, which is reproduction, for whatever reason. So it's not anyone's problem. And we have actually, according to studies, if we want to classify the causes of infertility, we find that 40% related to the female, 40% related to the male, and 20% involving both of them, or we don't know the cause.
Oh.
Yes.
Okay.
So when it comes to the male, and we find that we have very, very low sperm count, then we might require IVF with this little sperm that's available, and fertilization is done differently in the lab, so that they take 1 sperm, 1 egg, and fertilize. So their numbers might not be of essence. So that's one. Or sometimes we find someone has 0 sperm count. And when we do their hormonal check, even men, hormones is what affects sperm production. And we find that the hormones are okay. So we suspect that there's a blockage in the vas, that is the conduit that brings sperms to the ejaculate. So if we find that the hormones are fine, then we try and get sperm directly from the testicle. We get tissue from the testicle. We check in the laboratory and find if there's any sperm. In that case, then they will require IVF, because that sperm can only fertilize in IVF. Yes.
Wow.
Yeah. And another indication that some people, they just want to select gender. Maybe they have 5 girls or 5 boys and they want a girl. So that you can also do IVF to do gender selection. Or people with issues maybe like sickle cell or other genetic conditions that they do not want to transfer them to their children. we can do IVF, and then we test these embryos. It's called pre-implantation genetic testing to see the ones that do not have these genetic conditions, and then we transfer those ones. Yes.
Because you're saying in there were things we were doing in biology, and I can see them coming here. You're saying in what do I say? In one thing we are asking ourselves, if you're pregnant, or even before you get pregnant, are you able to know whether you'll get a disabled child or you'll get a child who is okay, especially with what you have said, genetical issues. So you are saying through the IVF, you're able to detect that if we used this one, the child will be this, so we can choose this one, but from the same parent.
Yes. So in IVF, when we have to fertilize, we get the sperm. We don't test we can do genetic screening on the parents. That's different. But for IVF now, we have the egg and the sperm. We fertilize them. And then we create embryos. So these embryos, we can test them. It's called pre-implantation genetic testing. For genetic conditions that could be existing in the embryo. So if you have 6 embryos, for example, we test all of them. Then we find 2 have issues, or 3. Then we have 3 good ones. So we transfer the 3. Yes.
Wow. Yes. By the way, is there any other reason that can cause a lady's eggs to be reducing apart from age?
So sometimes we have something called premature ovarian failure, whereby you get a woman below 40 and her ovarian reserve is already depleted. So this can be caused by genetic conditions that can cause this woman to have her eggs depleted early, or autoimmune. Her immune system is fighting the eggs, fighting the wrong things, then depleting the eggs. Yes. So, or unknown reason. You can just get a 36-year-old, eggs gone. Yeah.
Are you able to, can I reserve them? Maybe I'm not ready for IVF today, but I'm afraid that my age is going, and especially maybe you don't have a spouse today, but you know you want to get married and get your children. Can I come and reserve my...
Yes. That's actually one thing I tell my friends. Because we are almost in the same age group, and the time is also going. Yes. So yes, you can freeze your eggs. Yes, you can freeze your eggs. For if you do not have a spouse right now and you want to get your own biological children later, you can freeze your eggs now. Also, other indications why people come to freeze their eggs is if somebody is going to undergo cancer treatment that's involving chemotherapy, radiotherapy, and so we recommend that they freeze their eggs before going for that treatment, because chemotherapy can actually affects your ovarian reserve because it's killing cells. And also radiotherapy involving the pelvic area can affect the ovaries as well. So such people also can freeze their eggs before going for treatment. Or if someone has endometriosis that is really affecting the ovaries, they require surgery which is going to involve the ovary. We recommend that they come in, we do stimulation, we retrieve their eggs and freeze, and then they go and undergo their endometriosis surgery. Yeah.
What's the procedure? Is it like IVF?
So it's the same procedure as IVF, which I can just highlight quickly.
Yes.
So IVF procedure involves, of course, the initial evaluation of the patient and all that. And then now when we start treatment, the first phase is stimulation of the ovaries, where this person is going to get injections to stimulate the ovaries to produce eggs, to grow eggs that are already there. And then after like 10 to 14 days, these eggs are ready. Then they are retrieved outside the body. So if somebody is freezing them, the process stops there. The eggs are frozen. But if they're going through with the IVF treatment, then those eggs are fertilized, embryos are created, and then some people do 3 days. After that, then these embryos are returned back to the uterus. And the extra embryos are also frozen. So if someone is freezing their eggs, it ends at that once we have the eggs. But later in life, when they want now to conceive, they have to go through the entire process where those eggs have to be fertilized, and then embryo transfer has to be done, where the embryos is taken back to their uterus for conception.
Okay. I'm getting excited. I know we will discuss IVF in depth, but I'm getting excited about this one. How long can one freeze their eggs, and what are the cost implications? And where do we freeze them?
Okay, so how long? So now you can freeze your eggs for as long as possible, 10 years, 15. But the downside is eggs are not as stable as embryos. Okay, so when you freeze eggs, you might not, if you freeze 20 eggs, for example, you might get 15 that are okay, or fertilization might occur with 15. That's just a rough number. But embryos are more stable. So embryos can be frozen for longer and they're still stable. If you freeze 3 embryos, you might get the 3 embryos in 10 years. They all will still be there.
Okay.
Yes, but eggs. But now we recommend freeze. If you have a partner, maybe you can just do the IVF and try to conceive then. But if you do not and you want reproductive autonomy, that means you want to select the partner later. Maybe you don't have a partner now, so you cannot take a sperm donor and fertilize your eggs. You want to fertilize them with whoever you want. That is reproductive autonomy later in life. Okay. So it depends with your situation. And so now the second question you asked is where. It has to be in an IVF clinic, definitely. And I think there are several in Nairobi. So you can check online maybe. Yes, there are several IVF clinics. You can go and see. So now the issue is with the cost. So because IVF is private, the cost is not really regularized across. You'll find another clinic is charging you 400,000 up to the point of retrieving the eggs, another one 500. So really the price ranges maybe between 400 to 500 for freezing, for producing the eggs. And then there's a freezing cost, yearly cost, which also really varies. Okay. I know a place where it's 15,000 a year. Another one could be 100,000 a year. So really, it's not regularized. Okay. Yeah. So if you want, you can just go and have a consultation, get the fertility specialist to explain to you their cost implications and all that. But you should start. Don't sit there and say, oh, because now if time is going and you have the finances, I think it's important you can freeze your eggs.
Ladies. They are scaring us that age will catch up with us.
Corporate babes.
Corporate you need to achieve before we start, so we can go and just freeze our does quality of our eggs change with age?
Yes.
So would you advise a young person to do the same?
Yes. So you see, this is something I really need to thank you for this platform, because I get a chance to educate people on this.
Yes.
Because I have a relative, she's 50 something, and she came to me and told me, I'd like to come and do IVF with my eggs. And I didn't know what to say. So it's important that we understand, as women, we are born with all the eggs we will ever have. Actually, when a woman is pregnant with a baby girl, with a fetus, a female fetus, by 20 weeks, all the eggs that this child that she's carrying would ever have already been formed.
Wow.
So there are millions. So by the time this child is born, these eggs have already reduced, by the way, from birth. And then this girl is growing, gets to puberty, starts to have her menses and all that. So by puberty, the number has significantly reduced, and we're having around 400,000 eggs by the time a woman starts now her puberty. Okay?
Yeah.
So we don't lose one egg a month.
A month.
We lose close to 1,000 eggs.
Who sent you now?
It's very important I say this.
We always say we lose one.
So every month, eggs are recruited that are going to grow for that month. And then one is selected, the dominant one.
Yeah.
The rest die. Tena continues like that. And it's not even at a monthly thing. It's a continuous process. So by the time a woman is 35, her fertility is still fine and the loss is steady. But then from 35, from 36 now and beyond, now this rate of losing eggs is just fast. Like now, the eggs now they're just dying. I know how it sounds, but yes.
And you know, you're
By
talking
37.
about us who are in that.
Yes.
She's talking about us and you.
By 37, close to 80% of the woman's eggs are gone. But you can still conceive.
Okay.
So by 46 years of age, really, the eggs are depleted. And okay, of course, this varies. Utapata one person is getting pregnant at 45, naturally, or 46, or 47. There are those, of course, outliers. But even if you show up at an IVF clinic at 47, and we do your test and we find there's a little bit of ovarian reserve, now the issue comes in of quality of those eggs. Even if you have some eggs, a little bit, what quality? Because at the end of the day, you have come for treatment. You're looking for a conception. You want a baby.
Yeah.
You're not coming to try a treatment. You're coming to try, and the outcome that we are looking, a good outcome is a baby that you take home, right?
Yeah.
Yes. So now with these eggs that are aged, the quality is bad. Also, of course, the eggs are close to depleted. Yeah. So it's very important that we understand that age is a very, very important factor in fertility. And it's both male and female. But for females, our biological clock is quite short. But men, their biological clock, men have also a biological clock.
Tell us.
Yes, because also the quality of sperm with age, now for them from their 40s going up into 50s, also the quality of sperm goes down. There's something called DNA fragmentation. The DNA in the sperm, there's issues with that.
Okay.
So now achieving a successful conception can be a problem. Or also now issues of genetic issues like Down syndrome can also come in.
Okay.
Yes.
They told us a man can conceive, or rather a man can impregnate up to, sorry, there's choice of words I'm using, I'm not a medic, even at 100 years old.
No, the quality of that sperm is gone.
Okay.
But yeah, but for men, you see the difference now is, for us, we are born with all the eggs we'll ever have. But men they're born with cells that produce sperm. So men make sperm every 3 months, a new batch.
As we are born with everything.
We are born with the stock.
We are just reducing.
Yes, for them, they have cells that produce sperm so they have like a new batch of.
Okay.
Yes, you had asked an important question. Please, I don't want to forget to answer. That when is it a good time to freeze? You see, if someone is 25, they're so young, they still have time. So if they froze their eggs at 25, chances that and they don't have any fertility issue, chances that they will meet a gentleman at 29 and conceive naturally are quite high.
Yeah.
Compared to a 28-year-old who might not, So from 28 to 35 is a good time to freeze.
Okay.
Other than that, you still have a bit of time, unless you have a medical condition that requires you to freeze your eggs. Yes.
Okay.
Yeah.
Plus, I think the duration you said about 10, 15 years. So again, if you freeze too early at 25, and maybe you want to
conceive at 40.
Yeah. So then again,
that's a long time.
Wow. Let us now go to, something else you mentioned about the reasons why a woman would be going for IVF. Well, we've seen about the ovaries. Then there's something you said about fallopian tubes, and you said about the blockage. Can't we unblock them instead of going to IVF?
Oh, that's a very, very good question. Yeah, we can unblock the tubes. It's a surgery called tuboplasty. So it really depends on the level of blockage. So if the tube is blocked really close to the uterus, where the tube is attaching to the uterus, there's nothing you can do about that. You can't unblock that. Okay. So that one just goes straight for IVF. But if it's blocked further out, then you can try and unblock that. But now the chances of conception is less than 4% with that. Because if a tube is blocked, then we are assuming that whatever caused the blockage, maybe it was an infection or a surgical procedure or inflammation from endometriosis, that could have affected the entire of the tube. So the lining of the tube is also important in propelling the sperm and the eggs to meet. That's how the lining is designed in a certain manner.
Okay.
So if this lining is damaged, that tube might not still work.
Mm-hmm.
And so sometimes when you just find someone with blocked fallopian tubes, you advise they go directly for IVF because the success is like less than 4%. So that money and effort and all that you're putting in and blocking the tubes, we can just put the same in IVF. Yeah.
Oh, wow.
And save money and time.
Okay.
Yes.
We still had the same issue with men. They have blocked. You didn't tell us the name. The passage to
yes.
Can they be unblocked also?
Same, but now that is a bit more difficult compared to the fallopian tubes.
Okay.
But yes, the surgery can be done to unblock. It's called the vas deferens. I was just avoiding medical jargon. I don't know any other language for that.
Okay.
Yes. So yes, men can also have blocked vas deferens, and that's the conduit that brings sperm from the testicle to the ejaculate.
Yeah.
So you can find someone, they have 0 sperm count. When you do a semen analysis, you check their semen, there's no sperm. And then I had mentioned when you do the hormonal tests, you find they're normal. So you can go directly to the testicle and try to get tissue out and check if there's sperm in it. And sometimes you get sperm if it was an issue of blockage.
Okay.
And then you can use that sperm for IVF.
All right.
Yes.
What do you do to them when they have hormonal issues for men?
So if it depends with so for a man, first of all, the first test is the semen analysis, definitely. If there's 0 sperm count, then now we do the hormonal. So we check the testosterone, and we can also check a hormone called FSH. So we can give medication to replace these hormones, but mostly we normally just go straight to the next phase if it's getting the sperm directly from the testicle, or if it's what is it called, a sperm donation. But we can give hormonal replacement. Yeah.
Now take us, Daktari, to IVF. We have had all those conditions, and maybe you will tell us after we discuss about IVF. Maybe you can tell us some of the things that cause these issues to happen. Maybe the blocked fallopian tube, ovarian, and all that. But before we come to there, now IVF. Before one comes for IVF, what are the preparations, or what happens?
Okay. So the first thing is you see a fertility doctor. First step. And then now, once you're at the doctor's place, then the doctor will evaluate and see where the issue is. So, for example, if a lady walks in and they have been trying to conceive for 1 year, maybe the lady is 28 years old. So there are tests we have to do, the hormonal tests, to see if the hormones are okay. One of them will show us the ovarian reserve. How is the ovarian reserve? Another test that we have to do is just a scan. We just do a pelvic scan and see how are the ovaries looking like, how is the uterus looking like, is there any issue, structural issue, is there a fibroid, is there a cyst, things that can be worked on before you get to IVF. So once that is done, then we have to send also the woman for a test to check her fallopian tubes, if they are open or closed.
Okay.
So with all that, then we make the decision, are we going for IVF straight up, or can we start small? Can we start with intrauterine insemination, and then we move to IVF if that doesn't work? So you first with the evaluation. So if we evaluate this woman and find, okay, this woman requires IVF, then now that's the next step. So preparation for that, it depends. So with the tests that we have done, do we need to treat anything? Is there a fibroid that we need to remove before? Is there anything that we need to do before now we do the IVF treatment? And also the general well-being. Is this person hypertensive? Is this person diabetic? Is there any other medical condition that we need to deal with before? Now we go into preconception now to take care of this woman before now she can conceive now with the IVF treatment. Do we need to replace vitamin D? Whatever it is her blood level okay? Yeah. So there are some supplements that can be given, maybe to improve the quality of the eggs, but that does not necessitate to delay treatment.
Okay.
If you need treatment, everything is fine, we can start treatment.
Okay.
Yes.
Now we come to IVF procedure. I know you had slightly mentioned when you're talking of freezing.
Yeah.
But what is now the whole procedure?
Okay. So there's so it's in phases. So there's the stimulation phase where the woman gets injections. These injections is hormones to make her ovaries to produce more than one egg. Normally, in a cycle, I had mentioned earlier that only one egg will grow. So this one, we want more eggs. These eggs that were supposed to die, by the way, they're the ones we're trying to grow with this treatment, so that many of them that have been recruited can grow in that cycle, so that we have many eggs for the treatment. So that's the first phase of stimulation, where a woman gets injections every day for 10 to 14 days, depending with a person's response. Some people by day 10, the eggs are ready. Some people, we have to go up to day 14, which is still fine. So and then we'll be doing scans to check and see, are the eggs ready? So once the eggs are ready, then we do the egg retrieval procedure. Done under sedation, it's a day procedure, just 20 minutes, 30 minutes, and someone should be out.
Okay.
And then once the eggs...
Painful?
So you are sedated, because we are using a needle. It's transvaginal. So yeah, if you...
Nothing you're nursing after at pains or anything?
Just painkiller because we have used a needle to prick to get to the egg.
Okay.
Yes. But you are sedated so that you don't feel the pain. Yeah. So once the eggs are out, then we require the man to produce the semen so that we can use the sperm to fertilize the eggs in the laboratory. And then these eggs are grown for 3 to 5 days, but most clinics are just doing 5 days. And then on day 5 from the day of retrieval, on day 5, we do embryo transfer. So the embryos we made, we transfer 2 to 3 embryos, mostly 2 embryos, into the woman's uterus. And now, after the transfer, then we have to support the woman with a lot of medication, injections, hormones to keep this pregnancy. And then 2 weeks after that, we do a pregnancy test to see if the pregnancy was successful. Then after that, we will do a scan at 8 weeks and see how many do we have, are they viable? And then now we continue now with antenatal care. Yes.
A very smooth procedure as you'd explain it. We are even seeing this baby coming out. We are seeing this woman coming, because of course you said by the time you're putting them there, they are embryos actually. Yeah. We are not, this is a baby actually. So we just want them to attach and grow. What happens? Why would a woman now be negative for pregnancy test?
Okay. So that's actually the most difficult part about being a fertility doctor. Because you see, the same way this woman has come and wants a baby, you're already now in this journey with this woman. So if this woman gets pregnant and gets babies and even comes with her twins to your office, oh my God. I have a text from someone, she texted me the other day and told me, my boys are now 2 months.
Oh.
The joy. So we share in the devastation. So now there are some factors that can explain implantation failure, whereby we have put embryos and the embryos have not held, so there's no pregnancy. But most of it is unexplained. And I know when you go to the doctor, you want explanation. You went to school for this thing. You've told us you have a master's in IVF. We need an answer.
I've paid
600,000, 700,000. I want an answer. And you're the expert in this thing. But the truth of the matter is, for me, when a patient walks in, I will, in the first consultation, and I tell you need IVF, I will tell you, based on your factors, I will try to calculate your percentage based on your factors, your age, the ovarian reserve, the sperm quality, everything. And then we can say, okay, your chance here is 40% before you get the first injection for IVF, for stimulation. So that you know that this is my chance. I'm giving myself 40% chance. Yes, I'm paying 700, 600,000 for 40% chance, or 50% chance, or 60% chance, but it will never be 100% chance. That's the unfortunate bit. Even in the best IVF clinic in the world, their success rate is not 100%.
Okay.
But for this person who gets pregnant, for her it's 100%. So so I was going to say the factors that will affect implantation. The quality of the embryo. So the quality of the embryo is determined by the quality of the egg and the quality of the sperm. How is the sperm? How is the sperm looking like? What are the sperm parameters? What are the egg parameters? How are the eggs looking like? That's what will give us the embryo. So that is one. Another factor that can affect if there's any infection in the reproductive tract, in the endometrium, in the cavity of the uterus, the endometrium, endometritis, any infection, of course, will affect your chances of conceiving.
Okay.
Also, there are small factors like laboratory factors, of which most of the time they're controlled because the strict measures that are put in place to ensure that everything is okay. But also there can be factors arising from the laboratory, from the medication that you got, from the stimulation, from the entire process that can affect your chance of conception.
Okay.
But even with the best embryos, even after we have the embryos, they're grade A, embryos are graded A, B. So even if the embryos are grade A, the best size, and we even go ahead and do genetic testing on them and they are genetically perfect, sometimes we still don't get a pregnancy.
Okay.
And it's unexplained.
Okay.
And you come to the doctor and we don't have an answer for you. And that's the most difficult part actually for being in this IVF space. Yeah.
Wow. Yeah, it becomes so frustrating when you've gone all through that and expecting a baby. Let me just take that because I know how it feels. There is, in case you've not conceived, there is a repeat with the frozen.
Yes.
Do you make us understand that?
So, for example, if we had 6 embryos, good embryos, then we transfer 2 embryos, we will freeze the 4. So that in the event you do not conceive, or you conceive and then you want the second baby, then you come back. So in that case, we will not have to start with these injections, making it the eggs, getting the sperm. We already have the embryos. So we'll do some treatment on the woman to prepare her uterus to carry the pregnancy, which is a bit easier compared to the other one. And then now we do the embryo transfer. It should be cheaper because most of the cost goes into creating these embryos.
Okay.
Yes, so it should be cheaper. Different clinics, different prices, as I'd mentioned.
Okay.
Yeah.
If we've already conceived successfully and we don't foresee ourselves wanting to have a second baby, where do we take? What do you do with our embryos?
You can donate those embryos.
Okay.
Yes, you can sign that you're donating those embryos to a couple that needs. So that couple will not have to pay the 600-700. They'll pay less for the frozen embryo transfer package because now, so that will be making it affordable for another family too. Yeah.
Can't be a broker. They already know what I want to say.
There are ethics governing these things. Yeah.
Okay.
Yeah.
But I'm at liberty to do that.
Yeah,
if I come with my spouse and we want to have it and then we say just preserve them, then we look for someone who is looking for a child and we want to donate, we are at liberty to do that.
Yes.
Okay.
Yeah, mostly we actually prefer the anonymous donation.
Yeah.
Because now you'll be going to check that baby of ours.
Our baby.
Yeah. So mostly it's preferred if it's anonymous.
Okay.
So you just sign papers, you've anonymously donated our embryos. Yes. Yeah.
So you are saying the chances of IVF succeeding depends with the individual, depending with the factors that are there.
Yes.
So you cannot tell outrightly like the success rate of...
Of course, there's a general success rate for clinics. Like some clinics have kept their data and they have said this is our success rate.
Okay.
A general, which has included everyone who, and then they've done an average or something. But if a client comes to the office and they're asking what is the success, it's important to individualize their success because you cannot compare the success of a 28-year-old to a 41-year-old. It's different. But you can get this 41-year-old getting pregnant and the 21-year-old not getting pregnant. So it can be like that as well. But chances are higher if the couple is younger. chances are also higher if we already know the cause. For example, their only issue is blocked fallopian tubes compared to unexplained infertility, where every test is positive. I mean, every test is negative, everything is fine. And then we are still not conceiving. Compared to people we have checked, there's the tubes. That's a bit different. Yeah.
Okay. So, what in Kenya, I've had, they have IVF centers. I've had women testifying they're struggling with infertility. Even men now, they are coming up. But I'm yet to meet someone saying, look, I went to IVF and this is the child that I got. Are we having success?
We have success. A lot of it, actually. Like, I would put it at around 50 to 60%.
Oh.
And just to share, I think I shared that previously, that the reason I went into IVF, I was new at this IVF clinic, and then this woman walked in with a very beautiful baby girl. And we had a conversation. That baby was an IVF baby. And she mentioned to me how this really changed her life and all that. And that really just gave me, I just told myself, this is it. So we have seen, and now I have seen many, many IVF babies working in the IVF space. So there's a lot of success. The issue is the stigma that people have put that, those are IVF babies, So the stigma, people need to accept that this is a normal way of assisting couples to conceive. And the difference between your baby that you conceived at home and this baby that was conceived via IVF is just how the fertilization was done. This fertilization, unfortunately, could not happen inside, so it was done outside. So the babies are not different. Yeah, they're not different. So I think we have really, with the issue, they used to say test tube babies. We have really put a lot of stigma. That's why people are not coming out to share their success stories. That, okay, I went to IVF, I got my twins. I went to IVF, I got my one child. I got all my children IVF. People are not open because they'll be stigmatized, they'll be judged. Their children will be looked at differently. We need to really remove this stigma. We need to really replace this with sharing information. It will be easier because now people will have come out and say, these are my 3 IVF children. And it will encourage another person who's been afraid of going for IVF to go for IVF and get her children. Yeah.
And actually, that's why we are trying to do much of these talks to normalize it.
Yeah.
But I think it's still somewhere. And for curiosity, I don't know whether it's ethically right for me to ask this question. You'll advise me.
Okay.
In Kenya, do we have like adults? What is the age group of children who were conceived through IVF?
So the first IVF child should be 20 in Kenya. Yes, should be 20 or 21. I think 20.
In 20s, in their 20s?
Yeah, no, 20 or 21, like really 20 or 21.
20 or 21?
Yes. Yeah.
Okay.
Yes.
So you're confirming to us that this thing has been working in Kenya, it is working, and they live a normal, healthy life.
Yes.
Beautiful.
Yes.
Now, maybe we go back to Dogo and see what are the causes of these things that are causing infertility.
Yes. So I'll still also categorize male and female. Yeah. So for the female, we have talked about blocked fallopian tubes.
Yes.
And blocked fallopian tubes can be caused by pelvic surgery. Any surgery in the pelvis can cause adhesions, scarring, and blocking the tubes. Infection. In our setup, actually, infection is among the highest, it's ranking high in causing blocked fallopian tubes. Infection is sexually transmitted infections. Yes. Another thing that can cause blocked fallopian tubes, endometriosis, can cause blocked fallopian tubes because of the inflammation that is that goes on with that. Yes, those are the 3 that I can think about. And also another thing that is causing infertility, of course, age. Now women, we are corporate babes.
I tell you.
So we want to achieve PhD we want to reach the top of our career before we now think we want to conceive. At that time, age has really gone, and that's really, really, like in my experience in IVF, most of our people that are coming in are in their mid 40s or 40s, and now they're saying this is when I can afford the treatment, or now I have time, or, so age is a really, really important factor. Other things like lifestyle. Smoking for women is just prohibited. Use the word prohibited.
Okay.
For fertility, in terms of fertility, because really, really affects the quality of the eggs, really affects, the quality, and also the depletion can be faster.
Okay.
Yes. Lifestyle, obesity, the foods we're eating, excessive alcohol intake, drug abuse, those are things that affect both the eggs and the sperm. This one affects both. Even smoking affects both male and female. All the drug abuse, everything affects both. Lifestyle, obesity also affects both.
Okay.
For men as well, infection can also lead to blockage of the vas deferens. The same way it can lead to blockage of fallopian tube. Infection can lead to infection of the testicle. And if the testicle is infected, then it can affect sperm production. So an STI can go to your testicle and affect that.
Okay.
Yes. And also for men age, of course. And there's a 20% where it's unexplained.
Okay.
Unexplained. The sperm is fine. The egg is fine. The woman is not obese. The woman has never touched alcohol. The man has never touched cigarettes. But we don't know why they are not.
But God, who is God? I think that's why we say, but God, who is God.
Yeah.
We'll ask a very sensitive question. In terms of choosing a hospital, are there things that hospitals are able to do to improve our chances, where you think these ones have better facilities, it has better? IVF is IVF.
I might not have an answer for that, unfortunately. So it's up to you to do your assignment. You can visit the facility, ask what kind of, you have to do your part. You have to read about it, what is required. You have to have a bit of knowledge. I know then when you go to your doctor, you have to ask the right questions. Maybe another time we can do a session and see what questions to ask to know that this is a good facility, this is a place where I can do my treatment. So I might not have the answer for that, really. And different people, someone will say this is good. There's a group on Facebook, IVF support something. So people always type there and say, which is the best IVF? And 10 people will mention 10 clinics, This one went there, got pregnant, this one went there, so it's really what is best for you might not be best for another. Maybe how they were treated at the reception, maybe how, So really that's the assignment that now the patient or the client has to do. Yeah.
Beautiful. Wow. So much about IVF, infertility and fertility. Do you still feel like you have a question you haven't asked? Please comment down here below, because Dr. Sorry. We will look for Dr. and we'll answer those questions that you are having. And Dr., before I give you a chance to do your closing remarks and maybe educate us on any other area that you think I have not mentioned, let me ask you, we're giving us a scenario of someone who are at their age, they are at 50, 60, they feel I really want to try for a baby, but their eggs are depleted. Are there chances? What do they do?
Yes, so you can even be 40 and your eggs are depleted by Okay, so you can use an egg donor where someone else is donating their eggs, and if you have a husband and his sperm is fine, can fertilize with your spouse's sperm, and then you carry the baby. Yes, that can be done. 60 is a bit on the higher side. There was a story that in Uganda where someone had delivered, I don't know, was it, how old was
I think 62 there.
60 something. So there's a bit of ethical issues, and that really is dependent with each facility. Will we take in a 60-year-old or not? Will we take in a 55-year-old or not? Because also we are looking at what the complications of pregnancy. What pregnancy has its own complications as well.
Okay.
So for a 60-year-old, what are we putting this woman through? Is she fit enough? Does she have any medical conditions? So we also have to look at the entirety of the person, not just their desire to have a baby. Is this baby we are giving this woman putting their life at risk? There are issues of preeclampsia. There are other issues that could come in with a pregnancy. So also age, the patient has to really be evaluated. And also it's dependent from doctor to doctor or facility to facility, depending with their laid down rules and policies. Yes.
Okay.
Yeah. But if a woman's eggs have been depleted, yes, they can still get pregnant using an egg donor. And even if a man whose sperm has 0 sperm count can still sire children with a sperm donor.
Okay.
Yes.
Whether you know them or you don't know.
Mostly it's anonymous. But if some facilities allow if you bring your own egg donor, maybe someone.
Does that add extra cost?
No.
Okay.
No, I should be very careful. Depends on the facility. Where the place I know, it shouldn't, but depends really the facility. Yes.
Okay. Wow. Then I'll give you an opportunity to add us and wrap it. Wow, what an informative session that we've had. I think I've done about IVF, but I've not gone as deep as we have gone today.
Okay.
So I really appreciate the fact that you're able to give us those details, because we really need them, and they help us to make a decision whether we even want to try IVF or we still want to be afraid of that. And maybe a general one. I keep saying the last one, but this one is the last one. I'm not a pastor. Generally, how many times can I try for IVF? If I failed first, second, how many times can I?
6 times. If you fail for 6 times,
we say
we tried.
We tried.
Yeah.
Regardless of your age, even if you're young.
Yes.
Okay.
Yeah. But mostly, if you try up to 3 times, that's called recurrent implantation failure.
Yeah.
Then you can try same your embryos, but you get a surrogate.
Okay.
So that someone else carries the pregnancy for you. It's your genetic baby, but someone else carries the pregnancy for you. That's also something that can happen.
Okay.
Yeah.
Is it legal in Kenya for you to choose a gender?
You know, this assisted reproductive technology bill has not yet been passed.
Oh, yeah.
It's been in parliament. So, yeah, in Kenya, we are choosing gender.
Okay.
Yes. I will leave it at that.
All right.
Yeah.
Sawa. So maybe your closing remark to our viewers.
Yes. So thank you very much for having me here. I am an advocate I'm a doctor. I'm not a lawyer. For just educating. I'm very passionate about educating people about this fertility thing, this IVF process, breaking it down so that people can really know that there's help out there that they can look for. And the one thing I keep emphasizing on is that infertility is not a disability. It's not something now you start stigmatizing people about it, because it's not their doing that their reproductive system has failed to reproduce. So it's something we really need to be empathetic about. We really need to offer a lot of support to people who are going through this journey, to people who are unable to conceive, and just support them. Let's just be supportive. And another thing I would say is, if you've been trying to conceive for 1 year, please seek help. If you're a woman less than 35 years of age, and if you're more than 35 years old and you've tried for 6 months, please seek for help, because time is of essence as well. And so it's important that you get help, know what's going on with your body, and if that can be tackled, let it be tackled. And I think that's it. Thank you very much.
Wow. Thank you so much, my people. Thank you for keeping it here to Susie Yule Dadem. I hope this session has helped you, is helping you to understand. And today I think we have really understood much about men. Men. Hi. One thing I didn't know about the blockage about men, they can also go through a treatment of trying to unblock their uterine.
No, it's the vast difference.
The vast. I'm learning. So, guys, I am so excited that we are learning. And we might be laughing about this, and we will keep laughing when we are talking about them. But imagine they are very, very important. And until you're at that level, you may not really understand why we are talking about these things. But kindly support those people who are going through infertility. When you see a couple fighting infertility, don't even be so much bothered to know exactly what their problem is, because you are not a doctor, you will not really help much, but be there to support them, be there to help them, to seek help from the doctors, because also we have, I'm letting the doctor to go, but I think she can use her 1 minute and tell us about, because sometimes as people, Daktari, we think we see a couple, we feel for them, for sure we are feeling for them, we want to help, and we have our ideas. I know a shosho at my village who has a very humble, what do they call them? A humblist who has a very good way of mixing these humbles, and we are trying to help them. What are some of these things that you would tell someone fighting infertility to avoid when we are advising them?
Okay, so very important issue of herbal medication.
Mm-hmm.
So now the issue I have, or most medical doctors have about this herbal treatment, especially for infertility. So if you're a couple going through infertility, you have never been evaluated, we don't know what's going on with you, then you go and start taking the herbal medication. One thing is you're going to waste a lot of time with this herbal medication, and we don't know what is in the herbal, what are we treating. So for me, I always recommend, if you've been trying, just go and seek for help. Go and see a doctor, go and see a fertility specialist. Let's know what the issue is and let that issue be worked on, because you cannot treat blocked fallopian tubes with no amount of herbal medication will treat that, because it will not go ahead and block the fallopian tubes.
Okay.
And we don't know what's in the herbal medication. One time, as an intern, as an intern, there's a woman who, I was an intern in a public hospital, and then a woman came and she delivered. I was in obs-gyn rotation, and the baby had some deformities, and I was really concerned. Okay, it could be because it was a very rare deformity. So I just asked her questions just to try and see where could this have come from. It could have just been a problem with the genetics and all that. But then she told me, I'm not saying that's what caused the deformity, because we have not proven that.
Yeah.
But she said prior to her conception, she had taken a lot of herbal medication to try and conceive. And you see, and even the first few months of her pregnancy, she was taking the herbal medication. And that's a very critical period when the baby is forming. Mm-hmm. And we don't know the contents of this herbal medication. It could be having things that affect normal development of the baby. Mm-hmm. And as an intern, it was like my first rotation in internship. I just thought, okay, maybe this herbal medication that this woman took could have been the reason, because we don't know the contents. You see, there's some medications that if someone is taking, we have to stop them. Mm-hmm. When they start IVF treatment, for example, or if they want to conceive, because this medication affects they're teratogenic, they affect the normal development of the child. Mm-hmm. So if you are taking herbal medication, we don't know what it is in this medication, then for a reason you conceive. You see, we don't know what you have been taking. Will it affect this baby that you've conceived, that you've been looking for? That's one thing also. And that is not, we didn't verify what caused. I didn't know the medication she took, but just at the back of my mind, as a young doctor, then as a medical officer intern, I was like, okay, maybe this could have caused this. Mm-hmm. So we find somebody started trying to conceive in their 30s. They have gone to all the herbalists. Now they're 40. Now the ovarian reserve is gone. They have wasted so much time instead of just seeking for the expert for the specialized person in this field to give them, to evaluate and find out what's the problem. And some of the problems can be treated, like anovulatory issues. For example, someone with polycystic ovarian disease or syndrome. Mm-hmm. The issue is they're not having ovulation. We can give medication to cause ovulation, and she can try to conceive even at home. It doesn't have to be IVF. Mm-hmm. Yes. So I am not really an advocate for that.
Okay.
Yes.
So we help this couple to come to the hospital, not for
help
any
them to come
other
to the
thing.
hospital, where some people will go there, they're given some things to apply on their body, or to do what, you know. And one thing, I know you are a very religious person, but please allow me to say this. Yes, we find even church women. Yes, we have even IVF. You need to pray, because we can put those embryos and they will not. God will still, science has a limit, in my opinion.
Yeah.
As a Christian, And we need to pray as well. Even me, I pray for patients when I'm putting the embryos. I'm like, God, let this embryo hold. Let this woman conceive. Like I also pray for my patients. But you find people are not honest in church. They're saying, so someone came to IVF, found an IVF clinic, conceived, went and gave their testimony. God has terminated 10 years. This is very controversial. I don't know why I'm saying this.
Fertility.
And we celebrate. And of course, miracles happen. I know miracles happen. I'm a believer.
Yeah.
We say, oh, okay, yes.
Pastor so-and-so prayed for me.
I did. You're not telling the truth that, yes, I did all these things. And in addition, I went to an IVF clinic or I saw a doctor. I got treatment. Yeah?
Come on.
So it's something that, because you asked a question, what?
The things that we do.
Yes, like now there's that herbalist thing.
Yes.
And there's that, someone says, it's been 10 years and I'm still, so someone who gets a baby through IVF, so the other person who is trusting God for a baby comes to ask you, okay, says, oh, I prayed. Can we be honest?
Okay.
Even as religious leaders, I don't know if you are a leader in your space.
My husband is.
Can we be honest about this?
Okay.
Like, okay, fine. Even as a church, can we contribute for this woman to go for IVF? Can we do that? Can we do that?
Wow. A very important point there.
Yeah. And you find
important.
someone has wasted years and maybe her issues could have been managed.
We're only saying Pastor so-and-so prayed for me and wow, what a challenge.
So we need to have these conversations more, and I'm happy that you brought me into your space. Let's keep sharing knowledge.
Yeah.
I think sometimes it's lack of knowledge, so we can't really blame. We really need, those with knowledge really need to disseminate it.
Yeah. Wow. I hope Dr. will give us another opportunity, maybe some other time, for us to talk about now fertility. You know, we have been talking about issues in fertility, but we have not covered anything about now this woman who has conceived, their journey and all that. So maybe at some point we'll come and talk of people who are productive. But then in this show, I've never brought issues of people who are productive.
Yes.
I'm sorry.
And also another thing that we should talk about is how to support. That's a whole topic. How to support people going through infertility. How?
Okay.
Yes.
Wow.
Yes.
Wow, guys. So we are in for a treat, and I'm glad that Dr. is adding us. So that is a confirmation that she'll create time for us and allow us to edit at that for now.
Yes.
But keep watching here at Suzy Yule Diadem. Have you listened to the amazing story of our guest before she became a doctor? The things she has gone through in life. Sorry. The things she has gone through in life. The way she kept falling, waking up, falling and waking up until today she can proudly now come and advise us and talk to us because she has seen the journey that God has walked with her. If you have not watched that, kindly go to our previous video. I'll tag the link down here so that you go to our previous video, you can watch her and learn a thing or two. And now thank you for watching this episode. Kindly share with your friends and thank you for keeping it at Suzy Yule Diadem. For now, guys, bye.
Bye.